Good afternoon, everyone. We'll get started here in just a minute. All right, well, my clock says it's 1 o'clock, so we will go ahead and get started. Thank you for joining us for our June virtual Connect with Network Health event. We are happy that you are here. My name is Chrissy Bowe. I am a Senior Community Wellness Coordinator here at Network Health, and I am going to be your host today. And we are looking forward to spending time with you and appreciate you joining us for this virtual engagement and educational event. I would like to give a big welcome to our Network Health members, as well as my Network Health colleagues who are here with us today, and those of you who are joining us. These Connect with Network Health events give us a wonderful opportunity to live our mission here at Network Health, which is to create healthy and strong Wisconsin communities. And it's great to be here with you today. I know that the sun has been shining and there's blooms around. And so some of you have maybe been experiencing allergies with changing of the seasons and maybe stocking up on some Kleenex and Claritin and extra eye drops since allergy season is upon us. So I am looking forward to introducing our special guest here in just a few minutes, who is going to talk about allergy season, what to expect, and how to best prepare and feel good this spring and the summer. But before I do that, I have a few housekeeping items. First, if you have any technical issues during the event, please try leaving the meeting and then rejoining. To leave the meeting, simply click the leave button in the upper right-hand corner of your screen. And if you do have a question during our meeting today, please feel free to type your questions into the Q&A button. We'll also have some time at the end of today's presentation to help answer your questions as well. However, to protect your privacy, please do not submit questions with your personal information in them. If your question is too complex or we need to direct you to our member experience team, that number is 1-800-378-5234. And then after today's event, you will likely get a short survey. And if you could please help us out by answering some of those questions and give us your feedback, we would greatly appreciate that. So to kick things off today, I want to share with you what you can expect from today's presentation, and I'll share some brief information about Network Health, and then I will introduce you to our special guest, Beth Coopman, who will present information on seasonal allergies and the best ways to treat them. Remember, if you have any questions during today's presentation, please submit those by putting them in the chat or the Q&A. So today's event gives us at Network Health the opportunity to connect with you and support one another along our health and wellness journeys, whether in a virtual room like we are today or at an in-person event. Our connection with our community is important to us. For nearly 4 decades, Network Health has established strong roots in our local Wisconsin communities by putting our members first. We are owned by Freighter and Theta Care, a local health system. At Network Health, we take the extra steps to make health insurance affordable and understandable so our members can make the most of their coverage. Network Health improves the lives of local business owners, individuals, and families as we pursue our mission to create healthy and strong Wisconsin communities. Our employees, some of whom you'll meet today, demonstrate their dedication and passion to helping others improve their life, health, and wellness by getting involved with organizations that serve our communities. We put in the extra effort because we want to, not because we have to. We know you are our family, friends, and neighbors, so we are side by side with you in our Wisconsin communities. And thank you for joining us today and for choosing to spend time with us here at Network Health. Now it's time for me to introduce my Network Health colleague, Beth Coopman. Beth is a clinical pharmacist at Network Health. So hi, Beth, and welcome. Thank you for being here today.
Thank you, Chrissy. I'm glad to be here. I know this is the time of year when seasonal allergies can really show up after getting that break from the winter and the deep freeze. Um, those things can be called commonly the allergies or hay fever, is another term to be used that you might hear or read. You can notice too that the tree pollen is usually what happens first, earliest in the year, and that's followed by, the grass in the spring, and then summer and spring and summer, and then we have ragweed more in the late summer and fall. So when we talk about seasonal allergies, depending on what you're allergic to, can show up at different times in the year. And so, if we have a mild winter, we can have some of that early pollination, and then rainy springs can sometimes promote that rapid growth of plants, and maybe even increase the mold counts and things like that for those who have mold allergies. So sometimes you're wondering, is this, a cold? Is this an infection? Is this COVID? Is this allergies? And sometimes those symptoms can overlap, so that can be sometimes a little bit hard to distinguish what is the ailment and how to treat it. Um, one of the ways, if you're having fever and chills and muscle and body aches, loss of the taste or smell, those are those common COVID things that we've heard over the years. Taking a simple COVID test can help us understand if that's the case, and then we can, kind of try to minimize our exposure to other people to help avoid spreading those contagious things. Same goes for influenza. They have the influenza testing now, the A and B, if it is an infectious process. But the trouble is sometimes you can't really tell. Maybe you don't have a fever, but you're coughing, maybe a little bit difficulty breathing or shortness of breath, feeling kind of tired or fatigued, maybe have a little bit of headache or sore throat. And then commonly it's that sinus congestion and then sometimes runny nose. And sometimes people even have really itchy skin at times, depending on how they exhibit their allergies. So those are some ways that our symptoms can overlap, and sometimes we know, what might be causing it by what drug works. We start an allergy pill and our symptoms miraculously get better, then we can be pretty certain that that was a allergy mediated reaction that we're having versus an infectious process. Um, so that's kind of sometimes the challenges of knowing what exactly is causing our symptoms. One of the best ways to help with allergies is prevention. And so, depending on seasonal allergies, what your allergy is, you want to avoid certain exposure, depending on what the allergy is and the season it is as well. So, we often talk about in the summer, keeping your windows and doors closed, in your home and car. The problem is if you keep your windows open at night, all those allergens can creep into your house and sometimes make those symptoms worse. We talk about maybe using the air conditioning and those high efficiency filters instead of opening the windows to minimize your exposure to whatever's causing the allergic symptoms, the allergy symptoms. Some people, they mow the lawn and grass is their allergy. It's wise to get back in the house and take a shower and get and change your clothes because you want those allergens off at the contact of your body there. So, and sometimes I say too, maybe if you have that allergy to the lawn and after you cut it, it's so much worse. Maybe that's not your chore anymore. Maybe you do the vacuuming and laundry folding and someone else takes that chore over. So sometimes it's kind of understanding what your triggers are and trying to avoid them. Um, Other ways that your clothes can get, full of allergens is hanging them out to dry on the line. In those instances, it's better to use your dryer. And the time of day that you're outside can be, impactful as well. Tree and grass pollen concentrations are highest in the evening during spring and summer. And then ragweed is highest during the morning during late summer and fall. So if you know what pollen and what allergen you're sensitive to, be wise in watching the forecast of the pollen counts, and trying to again limit your exposure to what is causing your symptoms. Um, Work around the weather, kind of like I said already, stay inside on dry and windy days, and then after the rain, sometimes that can help calm down the allergens outside, and that might be a time to venture outside. So there's many routes of administration for medications. We'll start out with an oral allergy medication. There's two main groups, and essentially they're all antihistamines. So the idea of these drugs is to block the histamine because the histamine is what causes the symptoms of the runny, watery eyes, runny nose, the itching. All those things are related to a histamine release. And so the idea of these drugs is to block that histamine receptor, and so that will dull our body's response to those allergens in the air. We have the first generation antihistamines. That's what we're maybe most familiar with, or they've been around the longest. Benadryl and chlortrimeton are the most popular. The generic names would be diphenhydramine and chlorpheniramine. So you would see those on the back of the under the active ingredients on a box if you're buying them over the counter. Those generally work really well. Rapid acting work well. However, they have more side effects. So they're not quite as clean of drugs versus the second generation antihistamines. So we can have drowsiness, constipation, difficulty urinating, sometimes dry mouth, sometimes even dry eye. As we get older, those types of medications are actually on the Beers list, which are medications that we try to avoid in 65 years old and older, because we metabolize them a little bit slower, and those drugs can accumulate and then increase those side effects that are unpleasant there, and sometimes increase our risk of falling or dizziness too. So, in general, these would be ones where you want to kind of limit your exposure, just use as needed, and at the lowest dose that's effective. They do have quite a range of ages that are used, even down to 6 years old. However, sometimes kids can actually respond instead of feeling drowsy like older folks do or adults. You can actually have children find up being a little bit excitable or hyper. So that can be an opposite side effect that we see in children. Now, second generation antihistamines, I would say are a cleaner drug, less side effects, less drowsiness. Zyrtec, about 10% of people can get drowsy from, but Claritin is non-drowsy. And that I would say is maybe one of the first line for allergy treatments is Claritin. And if that doesn't work, sometimes we move on to Zyrtec or Allegra. But these are cleaner drugs, less side effects. If you do happen to have some, drowsiness from Zyrtec, some people take that in the evening time, and that would be a way to kind of help with that side effect if they do have that to take that in the evening. So sometimes, like I had said, you start with Claritin, and if that over time doesn't work, then we go over to Zyrtec, and then we go over to Allegra. There is a different medication called Xyzal that's over the counter too, and that's got a similar concept as far as a second generation antihistamine. That one's, I would say, might even have less side effects because of how that chemistry is for that particular one. So that would be a newer one that's over the counter as well to try. The big thing with Allegra is that it can interfere with juices. So we talk about orange juice, apple juice, grapefruit juice. By the way that it works on some transporter proteins in the body, it can actually inhibit how well Allegra works. So if you're a big fruit juice drinker, then Allegra might not be the best one for you because of that drug interaction and drug food interaction there. So And then the second generation antihistamines are nice because they can be used in younger children as well. So it's a nice medicine to have in the medicine cabinet, and the doses are obviously adjusted for younger. So sometimes you have to use liquid anyways, but it does have a wider range of age for safe dosing. All of these come, except for I think Xyzal, that's that newest one. All of them come in a generic version, and that is the most cost-effective way to get these medications, and they're over the counter in the allergy section, usually near the pharmacy or the medication section of the store. Um, an average of generic Zyrtec for about a 45-day supply we found to be about $11 at Walmart. So it's not terribly expensive, and it's a good medication to relieve those allergy symptoms. You can add on, if you have persistent nasal congestion, a decongestant like Sudafed. Pseudoephedrine is the generic name of that. You would have to buy that behind the pharmacy counter with your driver's license. That does work really well for congestion. It's not generally something you want to use every day. It can sometimes touch up blood pressure and heart rate. And so it is something for like heart patients. It's not necessarily a great drug to use, or it can sometimes, if you have prostate issues, different bladder issues, that can be an issue, but that can be a medicine to avoid, in other words. But you do see that on the pharmacy, behind the pharmacy counter, and some people do use that, but more of an as needed thing versus daily, just because of the side effects that come along with that. All right, so next we'll talk about nasal sprays. So we got the oral tablets talked about, and now we'll talk about nasal sprays. So there's quite a few over-the-counter nasal sprays, and again, they come in that generic formulation to save you some money. They're absorbed just in the sinus cavity, so that's nice because it's not giving you the potential of full body side effects because it's just absorbing in your sinus cavity exactly where they're needed. That works really good for congestion and runny nose there in the sinus cavity. Um, these usually, you start at usually the kind of the max dose, like the Flonase, 2 sprays in each nostril once a day. Once you're feeling a little bit better after a week or two of that, you can bump down to 1 spray in each nostril as kind of the maintenance dose. So sometimes we start with the higher dose and go down. It's not as an immediate of a effect, so you have to be kind of patient. Sometimes it can take a week or so to really notice the benefit. But it does work. I mean, it works really well for the inflammation in the sinus cavity related to allergies. And then we do talk about using the alternate hand method, plugging your nostril with your opposite hand on the opposite side, and then spraying the spray in your opposite nostril with your opposite hand. It's better to tilt towards the fleshy part of your nose. If you point towards the septum or the hard part, you can have more side effects, sometimes nosebleeds and irritation of the septum. So the alternate hand method is the best technique to avoid those kind of side effects that you can see if you do the middle part of your nose there. What else? So Flonase does come in a Sensimist, which has a lower volume and doesn't have a smell to it. Over the years, I've had folks say, well, this kind of has a medicine-y smell, or it's a lot of liquid going up there and it's dripping out. So there are some other options that are sometimes better tolerated for those that don't like either the smell or the volume of the regular nasal steroid sprays. So that Flonase Sensimist is one that they sell over the counter. It's usually a little bit more expensive, but might be worth it if you have problems with the volume or scent of the other sprays. Um, so that's another option. I also like Astepro. I don't think we have it on our slide here, but that's a newer one that's over the counter. It's not a steroid, it's actually an antihistamine for the nose. So I find that it can be less irritating, and sometimes with nasal steroids, if you have glaucoma, because you're spraying this in and that's so close to your eyes, If you have high eye pressures, steroids can increase high eye pressure, so that is something to sometimes consider if you have a lot of eye conditions or glaucoma. That the Astepro I actually prefer because it's not a steroid and it's an antihistamine to help with those sinus congestion and runny nose. Um, Alongside of that, saline is a great thing. Again, we're always trying to get that allergen off our body. So, a nice saline spray to kind of cleanse our nose and get the allergens off of that surface. And that's a non-medicine really. It's just a saline spray that you'd spray in there. Always trying to keep kind of a sterile technique, or if your bottle's pretty old, get that tossed because you want to make sure that's a nice clean product that you're putting into your nose. Um, what else? We also have Afrin. Afrin is a medication that opens up the sinus passages really quickly. It's works so quickly that people want to keep using it. However, you are really only supposed to use it every 12 hours for up to 3 days. If you keep using it, you can get rebound congestion where your nose essentially gets addicted to it. And I have seen it. I've got people buying bottles and bottles of Afrin and it's not good. So I just generally don't always recommend that because of that potential for the rebound congestion with Afrin. And it's just better to get in the habit of the other medicines that if you do need to continually use them, that they're just safer in general. So um, that that is the main things. Most of our commercial plans do not cover the over-the-counter allergy products. Our Medicare Advantage plan does cover the fluticasone. That's that generic Flonase nasal spray at tier 2. So that is on the Medicare plans coverable if anyone here has got the Medicare plans. And I think that's the main things. Was there any questions, Chrissy, that came up on these medications as I'm going through here?
No questions.
Okay, thank you. All right, so we will move on to the eye drops. So our third delivery route of medications is eye drops. So you have again the non-medication eye drops, which is essentially a saline eye drop or saline wash, I should say, or artificial tears. Again, we always, if you have itchy, watery eyes and you notice it's after you've been outside, one thing you can do is you take a shower and you use Johnson and Johnson baby shampoo and you wash up the no tears version, wash that up because sometimes those allergens get stuck in our eyelashes and then rubbing it just causes more irritation. So keeping that area clean, getting those allergies off of your eyelashes can really make a big difference as far as your symptoms and not making it worse there. And then besides kind of the saline washes and the tears to kind of keep those surfaces clean and cleansed, we can actually use antihistamines in our eyes. We have the Pataday, which is the antihistamine, and then we have the Aloe or Zatador, kind of a mast cell stabilizer, which the mast cell is also involved in, allergy symptoms. So, trying to kind of block those things and directly putting them into our eyes can be a good route to use for eye symptoms. So then again, if we take a pill, we can have whole body side effects potentially. If you don't have a lot of you don't have a lot of allergy symptoms, you just have eye allergies alone, some people can elect to just use the drops in your eyes to help with the eye allergy symptoms. And again, the Pataday, Aloe, Zatador, those are all offered over the counter. We do have decongestants, which Visine you probably is the most common one, but all of these are red eye relievers. And then the Nafcon A actually has an allergy medicine with basically a medicine to help with red eye. So just like Afrin, these are ones where you don't want to use more than 3 days because, again, it can get worse. You can get rebound redness in your eyes if you use this more than 3 days. So that again is, those are not my favorite. I like to, if we're going to use a medication, be on something that you can continue on because, allergies generally for people can be a chronic condition. So I kind of shy away from the eye and nasal decongestants because of those restrictions of how long you can use them. If you're really miserable, you can use them for, again, up to 3 days and then stop to get some relief. But if for continued use, the other products are safer to use long term. We also talk about administration of the eye drop. We want to wash our hands before and after. We're always trying to keep whatever we're using, whether it's the nasal spray or the eye dropper, we want to keep that nice and clean on the tip so we're not introducing anything there. So not to touch the tip of the dropper to the eye at all or to any surface if we can, to keep that tip nice and clean. And then contacts, if you have those, you want to have the contacts out, then put the drops in, and then about 10 minutes later, you can put your contacts in after the eye drop there. And so we have our phone number here. If you have really specific questions about, what medicines you've tried and you're still suffering, or have questions about drug interactions or side effects, those sort of things, we have our pharmacist line here to ask those type of questions. And we're happy to help with that. That's right in our wheelhouse, talking about allergy remedies, because those are very common. And there's a lot of products available to help with those symptoms. I didn't say this, but I want to quick say it. The nasal steroids are actually best for sinus congestion. If you take a Zyrtec tablet, it actually is not as effective for sinus congestion. So if that's your main allergy symptom, you're better off with the Astepro or Flonase for sinus congestion versus the tablet. So that was one thing I don't think I mentioned, but I do think is valuable to know if you're a sinus congestion type allergy sufferer. Is there any questions so far? I have a few that I could, common questions that I see, and answer those, but is there any questions out there for the group?
Don't see any questions coming into the chat or the Q&A, Beth. Um, Maybe some of those common
Yeah,
questions, like if you had allergies as a child, can you develop them as an adult?
Yes, and so that's a common question I've had over the years. Unfortunately, we can develop allergies at any point in our life, so it is common for adults to develop environmental allergies really at any age. So that can happen. You can be fine your whole life, and all of a sudden you're itching away, and a simple Zyrtec can make all the difference on that.
What about multiple medications? Can you use multiple medications to treat allergies?
Yes, that's another great question. Some folks, they try the Zyrtec daily, still suffering, then they need to add either the Pataday or the Astepro or Flonase. So theoretically, you could use your eye drop allergy medicine, your nose spray allergy medicine, and your tablet. So you could use all three of those. We always try to use the least amount to control your allergies, but if you really have severe allergies, some people have to use all three.
Great. And then what about like natural remedies such as local honey or pollen?
Sure. I do, if a natural remedy is available, I do like those options. However, there's really not much science behind the eating the local honey or pollen to help with the allergies. So most seasonal allergies are caused by like airborne pollen from grass or ragweed, and those are not the plants that the honeybees are necessarily visiting. So it's unlikely that the pollen you're allergic to is the pollen that you will find in your local honey. So it's fine to eat honey, of course, as part of your diet, but it doesn't have a lot of evidence beyond for treating allergies if you have severe allergies. I mean, there may be anecdotal stories where someone has tried that and it seems to help. The biggest thing is could raise your blood sugar if you're diabetic and that sort of thing, and making sure that you're not getting cavities or anything from the sugar that's in your mouth with that. But there's not a huge amount of evidence to support that, but I'm sure there's some folks out there that maybe have tried that and it seems to be helpful.
Awesome. Well, thanks for such great information, Beth, and for sharing that with us. Does anybody else have any other questions that Beth could answer? And there is a question that came in that says there have been recent studies about Benadryl on the brain and memory issues later in life. What are your feelings on Benadryl?
Well, kind of going along with that beers list comment that I had, besides worsening side effects, there is, I wouldn't say that it's cause and effect, but there's correlation perhaps between memory issues and dementia with those first generation antihistamines. So that is why I'd rather see folks on the second generation antihistamines versus the Benadryls, which is the first generation. So yes, there is some information out there that it is good to avoid the Benadryl for that reason. And I would say yes, that is wise to use a second generation instead to help avoid any chance of that correlation happening within an individual.
Any other questions? I don't see any more coming in, so I would just like to encourage you to connect with us in the community and online by visiting our social media pages and our community engagement tab on our Network Health website to connect with us out in the community closest to you. And I'd like you to say thank you to Beth for joining us and being here and sharing your time and your information with us. If you have any questions or would like additional information about what was presented today, please contact us or email me. My contact information is here on the screen, and then you could also put your additional information or questions in the comments in the survey. So thank you again for joining us today, and have a wonderful afternoon.